Hello.
Sir.
Hope everyone are there. Navina madam, please take over the dais and continue with the introduction of Dr. Haribabu sir.
Okay. Good afternoon to one and all. A pleasant welcome to a one-day national webinar on addressing drug challenges in health and humanitarian crisis on the occasion of the World Drug Day, organized by MEM College of Pharmacy in association with Indian Pharmaceutical Association, Andhra Pradesh State Branch. Without delay, it's time to start. Lectured by Dr. R. Haribabu Garu, MPharm PhD Professor, Chebrulu Hanumayya Institute of Pharmaceutical Sciences, Guntur. Dr. R. Haribabu Garu is working as a professor, head of the Department of Pharmacy Practice, Chebrulu Hanumayya Institute of Pharmaceutical Sciences, Guntur. Sir completed his MPharm in Pharmacy Practice from Annamalai University and PhD from Acharya Nagarjuna University. He trains students of PharmD at NRI General Hospital, Guntur at various capacities in providing clinical pharmacy services to the patients. Dr. R. Haribabu Garu has presented more than 25 research papers in both national and international conferences and published 37 papers in various reputed national and international journals. Sir is also a member of various professional organizations like International Society of Clinical Research and Pharmacovigilance Society of India. He is a peer reviewer of various reputed national and international journals. Thank you so much, sir, for accepting our invitation, act as a resource person for this one-day webinar in the occasion of the World Drug Day program. So please continue the session, sir. Hello.
Thank you, Dr. Navina. Am I audible?
Yes, yes.
Okay.
Yes.
So first of all, I want to thank the management, principal, and the faculty members of the Department of Pharmacy Practice for inviting me for this one-day national webinar on addressing the drug challenges in health and humanitarian crisis on the eve of World Drug Day. So today I'm going to talk about a very brief talk about drug abuse and the potential role of healthcare professionals. So before starting my presentation, I would like to quote a quote about made by Dr. APJ Abdul Kalam that you cannot change your future, but you can change your habits. And surely your habits will change your future. So this is a great quote made by Dr. APJ Abdul Kalam, the former former president of India, that we cannot change the future, but we can change our habits, because habit is the main reason for the word abuse. So habits and abuse are contemporary with each other, and both these two are responsible for making a person to reaching a stage called as a death. So what actually a drug means? So drug is a pharmaceutical substance used primarily to bring change in the existing process, such as a change in physiological, psychological, or biochemical. So change in physiology, change in psychology, change in biochemical nature in the cell causes a disease, and that disease can be treated with this simple pharmaceutical substance called as a drug. So here many people are having a big doubt. So what is the difference between what do you mean by drug use and what do you mean by drug abuse? So is there any close relationship between drug use or drug abuse, or is there any big difference between drug use or drug abuse? So simply speaking, so drug use means, so when any person is having any complications, any disease, so he approaches a clinician, a doctor, and he will be advised to take a drug. So why he is advised to take a drug? He is advised to take a drug for the treatment of an illness, for the treatment of the complication he is possessing, and he will be advised with a drug to prevent a disease as well as to improve his health condition, which is deteriorated. So this is the reason why people are advised with drugs, and they are the reasons for taking drugs. But the other pole is drug abuse. So drug abuse is a condition where People take drugs for no other reason. For no other reason. They don't have any medical complications. And that taking of drugs will make physical and mental functioning of that person, will change the physical and mental functioning of the person. So intentionally he keep on taking that drugs without any necessity. If he keep on taking the drugs which make him physical happiness, mental happiness, it is termed as a drug abuse. And I want to discuss about very few drugs which are abused nowadays, which we commonly see in our hospital, which commonly the young generations as well as old generation, that is people who are above 55 years are commonly, yeah, be in the state of abuse. So these are the three classes of drugs which are being abused nowadays. One is opioids, and second is depressants, and third is stimulants. So these three are commonly drugs which are being abused in our area, that is in Guntur and Krishna district. Although they are not available without prescription, but they are being abused nowadays. So I'll start with opioids. So what are opioids? So opioids are nothing but derivatives of natural products as well as synthetic products. Synthetic, we have natural opioids as well as synthetic opioids in the form of morphine, codeine, thiabine, diacetylmorphine, hydromorphine, hydrocodeine, oxymorphine, and oxycodone. All these are available for treatment purpose. For a treatment purpose, they are not available for abusing purpose. Basically, opioids are available for treatment purpose because they are very good drugs for treatment of pain, for treatment of pain. And opioids are similar to that of endorphins. And endorphins in our body, they are responsible for relieving of pain. So there is very close similarity between opioids and endorphins. Endorphins, which are released in our body, will make us to feel free from pain. We feel more comfortable. We'll be away from the pain. And the same property is also having with opioids when linked with that of endorphins. And in hospitals, prescription opioids are usually in the form of pills, which are used for treatment of pain. So for many types of pain, like so we have severe chest pain, angina, for cancer pain, and for road traffic accident pains, opioids are being prescribed in our hospitals. But opioids are having very large chances to have dependence and addiction. And this dependence and addiction makes the clinical people to reduce the prescription of opioids, because opioids are double-edged knives. Not only opioids, all the drugs which we are going to discuss are like double-edged knives, because so the benefit what they do and the risk what they do are at the ends. So if you are having good benefit, so you will have very bad side effects. And this dependence makes us to feel that we are having withdrawal symptoms. Whenever we find withdrawal symptom, that indicates with opioids, that indicates that we are in the state of dependence. And continuous use of opioids will make us to go in a state of addiction. So if we are in a state of addiction, so it will become mandatory that tomorrow if we don't take that drug, so we may feel that we will not survive. And that is the reason why most of the people who are under abuse potential, they go into a state of suicidal thought. So internally in our brain, so what opioids do? Not only opioids make us to release endorphins in our body, opioids also makes us to feel pleasure, to feel a state of pleasure, also called as euphoria. So generally, a human being is satisfied, not with money, not with any facilities he is having. He is satisfied with food which he take, and that satisfaction, that happiness for a human being is mediated with the help of the substance which is produced in our brain called as a dopamine. And this dopamine will be released when we have a very good meal. When we have a very good meal, so after completing a good meal, so we feel very satisfaction, and that satisfaction in our brain is created with the help of a substance called as dopamine. When you take these opioids or cocaine or any abusing substances, there the level of the release of dopamine will be enormous. It is multiplied to more than 100-fold, and this increase in level of dopamine in our brain will make us to feel more satisfactory to the an end. It will be up to an end. So that is the reason why people will become abusive, people will become dependent, and people will become addicted for all those drugs which are having the nature of drug abuse. So here I want to say one important point, that we have very few drugs which are having abusive potential. So not all drugs are abusive. Very few drugs are abusive in the market, in the hands of the clinician where he prescribed the drugs. Under that, one of the class is opioids. So who should be using opioids? So generally the opioids we use in our daily life daily life for the patients are for only two reasons. One is cough, and the other is acute and chronic pain. So for both cough and acute and chronic pain, so these opioids are being prescribed, such as morphine, fentanyl, methadone, oxycodone, codeine, and hydrocodone are available in different types of formulations, such as pills in the form of tablets, in the form of injections, in the form of syrups. They are available for treatment of cough as well as acute and chronic pain. So, what does opioid misuse mean? What does prescription opioid misuse mean? So generally, an opioid which is prescribed should be taken as per the directions of the clinician, as per the directions of the physician. But we people misuse in different ways, such as overdosing. He is advised to take 5 mg tablet, but he will take 2 tablets. It will go to a range of 10 mg, and that gives him more pleasure. That gives him more pleasure. Actually, he is advised to take in the form of a tablet, but what he does is he crushes the tablet, or he crushes the pill, and he powders that, and he take that in the form of a snort, means through the nose, or he mix with the normal saline which is available in a medical shop, and inject it into directly into the vein. So these are the different misuses which are made by the public, by the common man. Common man means who are in the state of addiction regarding opioids. And the second way is taking someone's opioid drugs which is not prescribed to him, and this is totally an illegal process, because so pain can be treated by many drugs. There are availability of many drugs. So only in case of the severe pain which cannot be treated, then only opioids will be prescribed, unfortunately. So people who are suffering with pain, so they go for misusing of opioid in the form of others prescription, and taking the opioid prescription to get high. High is nothing but a state of euphoria. So pain is always pleasure. Many people doesn't know that pain is always a pleasure to the human being, and this pain will reach to a next stage called as euphoria. Euphoria, you know about what is euphoria, a state of well-being, and that euphoria will be achieved once we conquer the pain, and that is done with the help of this opioid. And very dangerous things which we see in the people is mixing with alcohol and certain other drugs with the opioid medications which they are prescribed. This is too dangerous. There is 100% threat to their life, 100% threat to their life if they are mixing such opioid drugs that are prescribed with alcohol and other drugs. So what happens to our body and brain when any person take a opioid? So we have opioid receptors. So these opioid receptors are present on the nerve cells in the brain, spinal cord, gut, and all other organs. So because of that reason, opioids make us to feel more pleasure, more pleasure. So when these drugs bind to the receptors, they block the pain transport. So pain transport is generated from the external cells to the spinal cord and to the brain. Because these opioid receptors are present on the nerve cells, spinal cord, and all other organs. So they block the entry of pain into the brain. So when entry is blocked, we don't have that feeling of pain. And opioid receptors are also located in the brain reward center. So where they also release a larger quantity of dopamine. So dopamine is nothing but a satisfactory neurotransmitter. So the pleasure neurotransmitter. So opioid receptors all are also makes a person to feel a state of euphoria, and this causes a person a good feeling of relaxation and state of well-being. But repeated release of dopamine, repeated release of dopamine in the brain makes us to a condition, takes us to a condition called as addiction. So drug abuse, drug dependence, and drug addiction is done by the human being. It is not the drug. It is the misuse made by the human being. So what happens to your brain and body when you use a prescription? So not only a state of pain relief, not only the state of euphoria, the other effects that are present, that are seen with the opioids are your heart rate will be decreased, and you will have a state of confusion, and you will have a shallow breath, and you will have itching, nausea, and constipation. These are all nothing but physiological effects on different systems of our body, because opioids are present on all the opioid receptors are present on all the uh, uh, organs of our body, and that is the reason why they show these effects, such as decreasing heart rate, also called as bradycardia, increased confusion, and decreased breathing, itching, nausea, and constipation. So we come to a conclusion that opioid dependence happens only after seeing these symptoms. And these symptoms are restlessness, anxiety, sweating, abdominal pain, fast heart rate, excessive yawning, insomnia, and tremor. So these symptoms will, if these symptoms are seen in a person who is on opioid abuse, it indicates that he is in a state of dependence. So this dependence makes him to increase the dose, so that he will be feeling happy, he will be away from these withdrawal symptoms. This is the biggest disadvantage of these drugs which are having a abuse potential. So because you have withdrawal symptoms, now you are in a dependent state, and you'll go in a state of overdose. So when you overdose, then only you will feel more comfortable. And the signs of overdose are slow breathing, cold skin, shaking of the body, blue lips, and vomiting. If you are not properly identified, if you are not properly managed, you will go into a state of death. So, so these are the various things which are to be kept in our mind when we prescribe a drug with the opioids. So next class of the drugs which I am going to discuss is stimulants. So stimulants are those which are given to people who are at low, low. So low is nothing but a condition where they are suffering with some condition, with diseases like narcolepsy, ADHD, and who are having more intention to sleep, who are having more intention to be alone. So in those patients, these stimulants are prescribed. So what these stimulants do? So stimulants increases the activity and processes in our body. Stimulants helps us to be normal. So almost all we will be in a state of dormancy. So in that state, we cannot do our work properly. We cannot accomplish our activities properly. Such situations, these stimulants are prescribed. So very common stimulant that is prescribed is amphetamine and methamphetamine. So these two drugs are also available in the market, and they are strictly prescribed, strictly dispensed only with a prescription from a registered medical practitioner. So these stimulants have chemical structures that are similarly like that of the brain chemicals. So again, here we have two important brain chemicals called as dopamine and norepinephrine. And these two decrease in dopamine and norepinephrine makes us into a state called as low. And this state of low should be changed with the help of these stimulants, such as amphetamine as well as methamphetamine. So stimulants boost the effects of these chemicals in the brain as well as body, making us to be more active, to do our activities in proper manner, as well as to perform all the normal processes that are happening in our body. So when we prescribe stimulants, so stimulants are prescribed in a state of narcolepsy. So narcolepsy is a state where we confine to the bed, we keep on sleeping, and people who never get out from bed should be identified, should be checked that whether they are suffering with narcolepsy or not. And we all know about the state of depression, so where the people are not interested to mingle with others, people want to stay alone, and one fine morning they will go into state of suicidal thoughts. And ADHD, attention deficit hyperactivity disorder, so this is commonly seen in children. So this condition will make a children to delay in learning process. In those people, this stimulants are being prescribed. So how these stimulants are misused? So basically, the word itself is called a stimulant. So people will be more stimulated. So the people misuse these stimulants to go to a state called as high. Since the patient is in a state of low, so when they take the stimulants, they will go to a state of called high, which is nothing but again a state of euphoria, a state of feeling well. And people also misuse these stimulants by crushing the tablets and snorting, as well as by mixing with the normal saline and injecting directly into the veins. These stimulants are very, very dangerous, because these stimulants, they have a property to have emboli. Both amphetamine, methamphetamine are having very good potentiality to form emboli, and these emboli will block the blood vessels, small blood vessels, causing damage to the heart, as well as they also cause stroke. They also cause peripheral vascular diseases. So these stimulants should never be misused. If you are misusing these stimulants, obviously you will go to a state called as death because of the embolies. And these embolies travel in our body, and these embolies will block the circulatory system, respiratory system, and it may also block the renal system. So it is very dangerous to misuse these stimulants. And most of the people, particularly people who are in academic areas, so especially the control on amphetamine and methamphetamine was made strictly because of doctors. Because what doctors do is they try to read before exam, just that night of the exam. So what they do is they take one amphetamine tablet, so that he'll be more active, he'll be raised, he'll be in a state of high. So what he does is whatever, so total night he never sleep, and whatever he reads, he will remember that, and next day he used to he do the exam very well. And that is the reason why most of the doctors, they are addicted, they became dependent to this amphetamine. And slowly government had restricted these drugs to only those patients who are suffering with ADHD, narcolepsy, as well as depression. So stimulants, when the effect of stimulants on brain and body is so hair loss, skin problems, itching, sweating, teeth grinding, fatigue, impaired judgment, hallucination, and psychosis are observed with these stimulants when they are misused. So these are the withdrawal symptoms which we observe with stimulants. So whenever there is a withdrawal symptom, it indicates that he is drug dependent. So irritability, hallucination, fatigue, depression, impaired memory, insomnia, body aches, drug cravings, and unpleasant dreams are the withdrawal symptoms of these stimulants. And next class is depressants. So people who are in a state of who are high, here high means anxiety. So people who are in a state of high, they are supposed to be reduced. They are supposed to be reduced to a state called as low. And for that we use these depressants. Okay, so don't misunderstand that these are all antidepressants. They are nothing but agents which makes us agents which makes us to reach a state called as a low. So in this we have different classes such as barbiturates. Under barbiturates we have phenobarbital. Very commonly we use phenobarbital. Then we have Cico, Pento, Buta, Amo, and butalbital, and benzodiazepines, alprazolam, lorazepam, clonazepam, temazepam, chlordiazepoxide, diazepam, and triazolam are common drugs which are being prescribed to make us to a condition called as low. So indirectly, I can use a word called as a sedate. So they make us to a state called as a sedate. So what does depressant mean? Depressant means slow downing the process. Slow downing the process. So slow downing the activity which is firing in our brain and spinal cord. So mainly these depressants are given to patients who are in a state of anxious, who are more anxiety, who are in a state of panic, who cannot sleep. And based upon that, these uh, based upon this condition, they are divided into three groups. One is barbiturates, benzodiazepines, as well as sleep medications. So who should be using these depressants? So these are the various conditions where we use depressants. One is all barbiturates and benzodiazepines are used in seizure disorder, and very important condition called as panic attack. So panic attacks are being very normal nowadays. So young children, adults, and even old geriatric population are affected with this panic attacks. So panic attacks can be treated by using these depressants. So what is the reason for panic attacks is very commonly I had observed that most of the patients who are exposed to COVID-19 virus are in a state of panic attack. So which we commonly seen in our hospitals as well as our neighborhoods. They enter into a state of panic attack and they become hospitalized because of panic attacks. As well as in patients who have disorders like insomnia, sleep disorders like insomnia, So they are also need these depressants, because the normal activity in their body is changed. So that is the reason why they should be prescribed with this depressant. So again, how these depressants can be misused. So generally, depressants are available in the form of pills or capsules. Unfortunately, so people want to come to a state of low. So what they do is they misuse by crushing these pills and sorting those pills, as well as injecting them with along with this uh, normal saline. They keep on injecting to the center line and misusing. So transferring depressant to some other medications and doubling the doses and taking the depressant for fun. These are the various possibilities to misuse the depressants, and how this depressant shows their effect on the brain and our body. So depressants, they just slow down our brain activity. Since we are in a state of anxiety, since we are in a state of panic, so what they do is they reduce the brain activity. So when our brain activity is reduced, we have the following things such as slurred speech, decreased breathing, so increased sleepiness, increased disorientation, and lack of coordination. And all these effects causes serious accidents. So most of the patients who are taking with depressants, they die with accidents. So maybe a road traffic accident, maybe a fall from a tree, or maybe a fall from an building. So all these takes place when you are taking drugs such as depressants. And these are the withdrawal symptoms, as I am repeating again. So withdrawal symptoms in a patient indicates that he enter into a state of dependence. Insomnia, weakness, nausea, agitation, high body temperature, delirium episodes, hallucination, convulsion, and death also occurs with these drugs. Marijuana. So this is marijuana is also we call it as cannabis. So why I had included this topic? Why I had included this? This is, although I was talking about prescription drugs. Why I had included this? Now this is available at all places, and we are seeing students, especially students from the nearby areas, admitting into the Department of Psychiatry with the abusing of this marijuana. So what are the effects of marijuana? So marijuana, marijuana has circulatory effect, neurological effect, visual effect, reproductive effect, digestive effect, as well as respiratory effect. Neurologically, it shows anxiety. Circulatorily, there is increase in heart rate, and digestive, it causes dry mouth, and neurologically, it also shows schizophrenia and psychosis, digestive nausea, vomiting, and vision, dry and red eyes, and respiratory bronchitis, emphysema, COPD, and reproductive decrease in sperm count, as well as female malformation, fetal malformations are observed in people who are abusing marijuana, especially younger adults who are at the age of 20, 20 to 25 are widely consuming this marijuana, and they are affected with all these complications, and they are being taken to the hospitals for their treatment. So these are the common uh, symptoms which are being observed with people who are misusing this marijuana. Among that, so they are going to complications with bronchitis. They need special emphasis in treatment of bronchitis, emphysema, COPD, as well as tachycardia. And how this marijuana affects the brain and body? It is the dizziness, shallow breathing, red eyes and dilated pupils, dry mouth, increased appetite, and loud reaction time. So all these are becoming all these substance abuse, these prescription abuse, marijuana abuse are becoming very common nowadays. So it is the role of pharmacist, it is the role of healthcare professional, that is pharmacist, to take part, to be a part of team against the abusing potential of abusing of drugs in public, especially in younger generation. So my suggestion, so what I suggest is, so every healthcare professional, every pharmacist should participate in substance abuse prevention and assistance program within the healthcare organization. And also they should participate in public substance abuse education and prevention program, not only in hospitals, not only in healthcare organizations, even the pharmacist should take part in public substance abuse education and prevention program, especially in primary and secondary schools, colleges, parks, and civic areas, because these are the various areas. So where this prescription abuse, drug abuse, substance abuse will takes place, and we should voluntarily involve in educating and preventing these preventing the uh, uh, drug abuse in children as well as adults. And clinical pharmacists, they have a drug information center in the hospitals, so they should be a part of identifying the drug available in the blood of the patient in coordination with the medical laboratories. So based upon their medical lab values, by therapeutic drug monitoring values, we can identify the potentiality of the patient's life condition. So whether he will survive or whether he will not survive. And it is the responsibility of the clinical pharmacist to provide adequate information, drug information, with the help of the drug and poison control information systems. And always discourage the prescribing practices that enables the drug abuse behavior. Whenever you are in hospital ward rounds, or whenever you came across to a prescription with a drug which is having an abuse potential, it is the responsibility of the healthcare professional, especially pharmacists, to discourage the prescribing practices of the clinicians, as well as discourage the administration by the patients. Thank you for your attention. And if there are any questions, I can answer.
Thank you so much, sir, for sharing your knowledge about various aspects of drug abuse and what is the difference between drug use and drug abuse, and various examples of.
Yeah, you are not audible, madam.
Not audible, sir. Is clear? Hello. Hello.
We are able to listen, madam, your
Okay.
voice.
Okay. Okay. So thank you so much, sir, for sharing your knowledge about various aspects of drug abuse. And
Sorry,
what
madam,
are-
you are not audible.
So you have to unmute. Hello. Hello.
Yes, madam, we can hear you.
Okay. Okay.
Navina madam, continue this.
Oh, okay, sir. So thank you so much for sharing, sir, various aspects of drug abuse and what is the important role of clinical pharmacists and pharmacologists in the society to prevent this drug abuse and how to avoid these misuses of drug abuse. Thank you so much, sir, for participating in this one-day webinar. So I request all the participants, if you have any queries, without hesitation, can interact with Dr. R. Haribabu Garu. Please, I request all the participants, if you have any queries, please clarify. No. Hello.
I think no questions.
Excuse me, sir. This is the question from YouTube comment section. And the question here is, what are the natural endorphin that can be obtained except ganja, marijuana, opiates, etc.?
Yeah, I want to acknowledge First of all, I want to thank the management, principal, and the Department of Pharmacy for giving me this opportunity to participate in this one-day national webinar. Thank you, sir. Thank you for inviting me. Thank you very much.
Thank you so much, sir, for participating in this one-day webinar. Thank you so much. The next session. Chalo, sir, line okay. Without delay, next session by Dr. J. John Kirbukaran, sir, Associate Professor, Pharmacy Practice, Vikas Institute of Pharmaceutical Sciences, Rajahmundry. It's my immense pleasure to introduce you, sir. Sir completed D.Pharm from Director of Medical Education, Tamil Nadu in 2000. B.Pharm and M.Pharm from Dr. MGR Medical University, Tamil Nadu in 2005 and 2008, respectively. PhD from Faculty of Pharmacy, Krishna University, 2021. Sir worked as Executive T&B Apollo Hospital Private Limited, Chennai 2008 to 2010, followed by Assistant Professor in Gate School of Pharmacy, Rajahmundry from 2010 to 2013. In the same institution, Sir worked as the Associate Professor from 2013 to 2020. Sir presently worked as the Associate Professor, Department of Pharmacy Practice, Vikas Institute of Pharmaceutical Sciences, Rajahmundry. Sir guided more than 10 UG students, 30 PG students. Sir published more than 20 research papers. Sir attended 20 conferences, 35 webinars. Sir had a membership with various professional bodies like IPGA, IACP, IPA. So a warm welcome to you, sir. So please continue the sessions. Sir?
Yes.
I'm
Good
audible.
afternoon.
So
Yeah.
please continue the sessions.
Am I audible?
Yes, sir, it's clear, sir. You can start your sessions.
So very good afternoon, one and all.
Good afternoon.
I would like to thank Navina Madam, and I want to thank Dr. Prasad Garu, Principal, MAM College of Pharmacy, and the organizing team. And I have to mention a special thanks to my friend Dr. Satyanarayana, Professor, Department of Pharmacy Practice, MAM College of Pharmacy, and I also want to acknowledge the chief guest of today's program, Dr. TV Narayana Garu, my role model and my mentor. I just and I just want to summarize what has happened today in this event, starting from Dr. Ravi Teja, who has given a clear view about all the various drugs and its mechanism, and a very beautiful video at the end of his session, which has represented so many areas about drug abuse, and followed by Dr. Rakam, who has given a very thoughtful presentation by giving some calculations based on alcohol use and about other misuse and abuse of drugs. and also in the afternoon session, Dr. Haribabu sir, who is my friend, and also he has given a brief, a very good presentation about various pharmaceutical products which are being misused. And today's my topic, what I want to cover is about the impact of COVID in the drug abuse. So I just want to give some brief idea about certain statistical things. So disclaimer, this presentation is for academic and training purpose only, and I don't have any conflict of interest. And regarding the history of the World Drug Day, it all started on 7th December of 1987 in the General Assembly of UNODC, decided to observe the 26th June of every year as World Drugs Day. So what do you mean by UNODC? It is the United Nations Office of Drug and Crime, which helps in making the world safer from drugs, organized crime, corruption, and terrorism. If you are seeing this, drugs, organized crimes, and corruption and terrorism all have the common one is drug. If drug is involved, organized crimes are involved. If organized crimes are involved, corruption involved. If corruption involves, terrorism enters. So if we are eradicating the drugs, we can eradicate organized crime. We can remove the corruption from the society, and terrorism will be no more. And every year they create a theme, and this year theme is Care in Crisis, addressing drug challenge in health and humanitarian crisis. And the objective of this presentation will be to raise the awareness of major problem that illicit drugs, which is being represented in the society, to know the statistical update about drugs used in India, and to know how illicit drugs are increased day by day to achieve the goal of a world free from drug abuse. So in COVID-19, the challenges was unpredictable. None of us thought we will be doing these many sacrifices and many challenges. Non-substance dependence was there, and substance dependence was there. And what is our role in eliminating each and everything? So first and foremost, due to the media impact, whatever we are getting, we are just forwarding, or we are making it as a status, or we are just spreading some information. We don't know whether it is a real information or a misinformation. So first and foremost, what is our role as if we have some, if you think that if you have to give some contribution to the society, then whatever we are spreading, the misinformation or the information should be filtered, and it should be spread properly. And based on drug and drug abuse, whenever you know what is the benefit and the risk factors, so that you can educate either your students, or it may be your relative or your friend, so that they can face the problem correctly, and to provide evidence-based treatment and care. So in India, Indian Ministry of Justice and Empowerment released this book, which is called as Magnitude of Substance Used in India, which was compiled by NDDTC, and also research done by AIIMS New Delhi. So here what they have done is, it's a household survey, and in this general population from the age of 10 to 75 was been included, and in 36 states and union territory of the country was been added. And in this, the study was having questionnaires regarding what are all the common substance which are all legal and illegal substances also. So legal substance, we know alcohol is legal in India, and cannabis in certain part of India we have legality also. And in this total of 111 peoples were being visited in 186 districts, and 2,73,569 individuals were being interviewed. And here I am going to express few of the results which they have identified. So what was the main prevalence? So in this study, they have identified alcohol, cannabis, opium, cocaine, amphetamine, sedatives, inhale, and hallucinogens. Many people will not know what is inhalants. Inhalants are substance which we normally inhale. In this recent years, they have identified so many inhalant substance, like even they have used dry cleaning fluids, degreasers, gasolines, even glues, correction fluid like whiteness, paint thinners. These are all substances which are either a stimulant or a hallucinating agent when they are smelling. These are all some substances which are very legal. People don't know whether these substances are being used as a drug dependent drugs. Okay, so it is about the inhalants. And what are all the factors that influence young adults? So first and foremost is the social. When they are meeting some new peoples, they don't know what they are going to give, or what they are going to what they are going to do in the future also. So whenever they are meeting somebody, or whenever they are getting excited, or when they are becoming very impulsive, they started doing something which may hurt their entire life. And in other social issues, peer pressures of students. In the subject of family or BPharm, they are handling very so many chemistry subjects. They are studying chutics, they are studying pharmacology, so many different subjects they are studying. And I'm not exaggerating, but these are all the things which students are feeling in the pressure. And likewise, if you see the students nowadays, we are seeing more students who are studying MBBS and MD. They are the more they are the people who are getting more involved in this drug abuse, because the subjects what they are studying are they have more pressure. They are putting more money into their education. They are worried about their future. All these things create their peer pressure. And also family history is also having there are so many studies which says that family history or the person in their family, if somebody else are addicted, and their children's or children's children have more possibilities of being getting addicted also. Okay, and nowadays the availability is also very quite common. As I said about the inhalers, we don't know inhalers like paint thinners. Just like that, if you go to a paint shop and if you are asking for the paint thinner, they will give. They don't ask you why you are using this. They just give you. And during the COVID beginnings, we heard so many deaths were happened due to taking of illicit alcohol. They have consumed turpentine oils. They have consumed varnish. So many things has happened because those things are very much available compared to other things. And when in hostels, in dorms, through the friends, they are getting so many illicit drugs are also available. And poor academic performance also lead to poor academic performance means they are worried, or they are having fear whether their parents or their what will be the future. And as Haribabu sir was also saying, they started taking stimulant drugs which can enhance their brain activity. And once they started using it, it became an addiction. That is what it is happening. So that leads to drug dependency. And these are all some graphical representation about opioid. There are 2.3 crore users are there. Out of 2.3 crore users, 28 lakh people are drug dependent on opioid. They need opium every day. Otherwise, they will have withdrawal symptoms. Okay, so out of this opioid users, you can also see that opium is used by 11 lakh people. Heroin is used by 63 lakh people. And pharma opioids like morphine, codeine, fentanyl, all these things are being used by 25 lakh people. I said you about inhalants. Here you see the picture itself. It is not even children's are being used using inhalant substance. Okay, and they are becoming dependent for that substance. 8.5 lakh people are getting dependent on such substances. So we have to be very careful. And okay, I think one more. Yeah, it's here. Okay, alcohol. As we know, these two slides, whatever I'm going to show you, these two slides are in India. In certain parts, alcohol, almost all 90% of India has no restriction in access. I think only two states which have burnt alcohol. One is Gujarat and another one is Bihar. And all other states are having alcohol as a official, or it is not a illicit drug. And cannabis, there are in India, it is a legal substance in certain countries, especially a variety we call it as bong. Bong is a it is also made from the leaves of cannabis, but it is due to certain religious things. They are saying that it is consumable, and they are consuming. In this also, if you see that 25 lakh people are becoming dependent on cannabis. And alcohol is the most worst case scenario which is happening in India. 2.9 crore people are dependent. 2.9 crores. It is not very small number. It is one of the biggest number in the drug abuse. Okay, without alcohol, they are not. They cannot lead their life. They are becoming dependent. It is not about 2.9 crore individual people. It is about the 2.9 crore family. Due to alcohol, not only one fellow is getting affected. It is about the affecting of the entire family. So young students, you have to be very careful in consumption of alcohol. It is one of the worst case scenario which can take you to become so fast to get addictive. And these are all some other factors, which is these pictures I have taken it from I think from India Today, which has been released into 4th September 2021. And here these are also the same results which has been given by the AIMS study only. But here they have given a little bit more detailed things. Here 44% people are getting hospitalized, and 56% of people are not getting treatment, and only 25% of the drug addicts are getting treatment, and the rest of 75% of people are not receiving any treatment. So still there are many on the government side, there are very less number of rehabilitation centers. So if more number of rehabilitation centers are being established by government or private sectors, then we can make this addiction centers which can help in recovering or making the few of the population to quit these habits. And another one, this is about the worldwide comparison between India and Asia and the world. By seeing this chart, you can have a little bit happy in certain areas, but if you see about the opioids, India is leading by 2.06% compared to the world other areas. Cannabis, because in worldwide so many countries you can smoke marijuana in the public. Because of this, I heard many of our students, this is one thing which is very hard for me to take, that many of our students are interested in going abroad for studying, but I have also witnessed certain students who are just going to other countries that they can smoke marijuana in public. This is one very hard things which we have heard about, especially those students who are going to Canada and even certain parts of America. Everywhere cannabis or marijuana is a legal substance which you can buy it in their grocery shop just for smoking. Okay. And students, you have to be very careful on what you are doing, what is going to happen when you are going to this drug addiction may lead to death in a very short period. Okay, this is the same results which shows based on the state-wise one about the opioid consumption. In this, the northeastern part is very dangerous, like Assam and Mizoram, Manipur. All these areas are having high consumption of opioid, because in another article which when I was going for preparing this presentation, I found that the routes are very easy coming from Burma and Thailand. These by roadway they are bringing all these opioid substance to India, and they are growing opioid in that areas also. So for it is very easy for them to get in that route. Okay. But I see that in Punjab it was also little bit more compared to other states, and I'm happy that our state Andhra Pradesh is also not consuming that much. Regarding the opioid, Uttar Pradesh is also leading, but on the basis we can see that Assam, Mizoram, or having more things. And regarding this is about the ganja and or marijuana. In this also, if you see in Odisha, it is legal. So only Odisha is showing highest percentage. Even Sikkim is also having a higher number of thing. If you are going through and if you read the Indian Narcotics Acts, in that they have given so many details regarding what is how much amount of drug you can carry, what is mean by a small quantity, what do you mean by large quantity, what do you mean by trade quantity, so many different substance for carrying the substance also they are giving so many limitations. But in north and northeast part of India, marijuana or ganja, especially bhang, is an acceptable evil in that area, which is the reflection of this picture. And if you see the growth of drug-related cases, this has been taken from the National Crime Record Bureau. It has a constant increase in this, and in 2019 and 20, why it has been reduced? It is because of the COVID. If COVID is not there, automatically this is crime convicted. It is not. This graph doesn't show that they are using less amount of drugs. They are using more, but because at that time police were not searching for people who are trafficking drugs. They were more concerned about the spread of COVID. So these are all the implication of the survey. So 2.9 crore people were alcohol dependent, and 0.8 crore illicit drug dependent peoples are available in India. And this is a very, very sizable population. So it is very much needed to take action regarding the illicit drugs. So this is once again, I want to clarify what is in the drug abuse on a college campus, what is happening. Coping mechanism is nothing but when a teacher is teaching very fast, whether you are able to follow the subject or not, that is what is a coping up. So in the life, are you coping up? You will be always comparing whether your classmates or your relatives or your friends are becoming more you will be thinking that they are better than you, and this may compel you to do something stupid by taking some illegal substances. So it is nothing like that. Each and everybody is a different individual. You have your own pace, so you have to play in your own pace. You cannot cope up with the other's pace. So what is better for your pace, you have to identify that, and you have to develop your own your area should be in that area. And unforgiving experience, this usually happen in our home, and teachers and our mentors, they will be harsh on us, but due to some fear factors, some students are getting they started not coming to college regularly because they are not able to face their parents or teachers because they are having a negative thought process, or they feel inferior to come up with certain things. And peer pressure, as I said you previously also, regarding the peer pressure and boosting academic performance, for that students have started using illicit or drugs which can enhance their thing. So now during the pandemic, 13% of college students, every students were enjoying at their home. They were very alone. They were not going anywhere. So in certain times, in certain adult population, they got stuck into one room and they were unable to come out of their area, and there was nobody to see them also. They were being separated from their family, they were separated from the society. So they started consuming whatever things they get, either it is an alcohol, whether they get any substance or opioid or stimulant or anything, and they were having so much, they overdosed themselves. So did people use more drug during COVID pandemic? The data declares that yes, there was a very much increase in about the drugs during the pandemic emergency was declared in the March 2020. There was many research was found the increase in number of positive urine drug screening order, which was also been identified, and there were many positive results were identified based on fentanyl, cocaine, heroin, and methamphetamine use compared to the previous or compared to 2019. So has the COVID-19 pandemic impact the frequency of drug dose? See this, 93,000 drug overdose deaths were estimated have occurred only in United States in 2020 alone. And in one video which I see, which I was watching in YouTube, they were saying that this 93,000 death was more than the death which happened in COVID-19 in San Francisco. Okay, so there was more number of death happened beyond the COVID death. That is what the reality which happened in 2020. The highest number of overdose death was recorded in 12 months period, which is 30% increased from 2019. What is the why it is happening? What is the reason means? Because these peoples are taking their drug and they are overdosed, and the emergency team was not available. The emergency team was available only for the pandemic peoples, those people who are suffering from COVID. So these peoples were not taken to the hospital. Because of that, there was many death. Because as the third point say, because they were socially isolated, they were alone at the home. There was no people who were taking care of them. Thereby, the emergency services were not able to identify these peoples, and because of that, so many deaths has happened. So how we can prevent? So these are all some few tips which I am going to give to prevent substance abuse. So this is a disclaimer which I am saying that there is no way or no one way which can guarantee that we can prevent or abusing drugs or alcohol, unless otherwise that individual is ready to give up. So these are all some things. There are many scientific evidence that if you are thinking you can quit, you can quit. And there were the National Mental Health Program is also created, and government is also trying to create awareness on preventing the addiction. And in every district and taluk level they are thinking, and based on scientific evidence also, there are certain drugs which can which can reduce the addiction, and they can come out of the drug addiction. So understand how substance abuse develops. First and foremost, are you going to use this drug for recreational purpose? Whether the time what you are spending on this drug is needed. So if you are thinking that if you are having, if you are thinking to do some drug, then try to change your mentality to some other area. If you are interested in seeing videos, go on, see the videos, but don't get addicted to anything. Even nowadays, we are also addicted to mobile phones. We are addicted to many other substances also. So abusing prescriptions, when you are even there are many studies states that tramadol is also one particular drug. Tramadol is also a morphine derivative, but it is a opioid derivative, which is very much used for as a analgesic, but that drug is also been widely abused nowadays. So first and foremost, we have to avoid the temptation. Many of your friends may say that this will give this may give that, that may give this, like that. So at that time, you should think about your family values, and you should know what whether you are speaking with a healthy friendship, or the relationship is going to be healthy, or they are going to dig a big hole behind you, or that. So we almost we become most like those we surround ourselves by. So always keep this in your mind. If you keep good friendship in your circle, you will be also good. If you have bad company nearby, you will also become bad in some or other time. So it is just a fraction of a second, you become tempted. Okay, so if you think that you are going to visit some friend who is who has some substance abusing habit, so before going itself, in your mind you keep a small idea how to escape from that pressure. You should have some excuses before you are going to that place. I'm not saying that you should not go to that place, you should not do like this, but you have to be very careful before you are going. So suppose if you are already having some problem, so first and foremost, be open and start thinking of going and meeting a professional counselor. Those people who are having a license, counselors who can give you a very good relaxation, or very good methodology to get relaxed, and to come out of your depression, or come out of your stress, and come out of your fear, everything. Those people are professional and they are trained for that. So you can always use a professional psychiatric counselor to come out of some mental illness, and they will also help. And you please speak with your concerned staff that if they are if you are unable to follow their lecture, if you are unable to satisfy your parents, or if you are unable to satisfy what your teachers are expecting, go speak with them privately and say that, sir, I am having only this is my capacity, I am not able, I cannot come, I cannot cope up with this. And if you are expressing your thing, surely your parents and your faculties will come to know what is your capacity, and they will change the method how they are treating you. So try to be drugs is not the solution. So examine the risk factors. So look at your family history of mental illness and addiction. If it is so, you should be very careful. And there are the more you are aware about your environment and physical risk factor, then you can overcome. So be very you should be very judgmental in this society. So keep a well balanced life. So it is not about it is not about your study, it is not about your habit, it is all about whom you are, how you want to take your life to the next level? Are you going to be a good citizen, or are you going to give your knowledge and your work to the society, to your family? So these are all things which you should be very aware about. And if you get stressed, there are so many stress relieving factor nowadays. Yoga is being practiced everywhere. There are so many meditation centers are there. There are so many meditating musics are available in YouTube. You go, relaxing musics are available. You can hear music, divert your thought process, so that you can overcome your stress, and you can come and you can balance your stress as well as your health life. So keep your goal and dream for your future, and your future should be very bright. And this one, today morning I received a message from the group that government Ministry of Home Affairs is saying a pledge regarding say yes to life, no to drug. If you are interested, you can scan this QR code. It will take you to that particular website, which is from our Indian government. And if you are reading that pledge, and you can create a certificate for you, surely it will be something helpful for you. So I will leave the screen for another few minutes so that you can use it. If you are if you want, I can also put this. Second. I will also put it in the group, in the chat. You can just, sorry. Let's go to times. Yes. So if you click that, it will take you to the page where you can pledge yourself that you are saying, please do it from your heart, and say yes to your life, not to drugs. And with that, I conclude my thing. These two pictures I found it from Facebook. It is a hand-drawn pictures regarding say no to drugs and yes to life. So with that, I want to acknowledge MAM College of Pharmacy, Narsapet, for giving me the opportunity to share my thoughts about drug abuse to all the students. Thank you, sir.
Thank you so much, sir, for sharing your valuable information and your knowledge about various aspects of the drug abuse and how these drug abuse affect in COVID pandemic situation, and what are the things about alcohol abuse and cannabis, and how the incidence and prevalence of these drug abuse over the India, and also development, how these drug abuse develop and what is the risk factors, and how to avoid these drug abuse in a very innovative manner. Thank you so much, sir, for participating in this webinar. Thank you so much. I request all the delegates, participants, if you have any queries, you can clarify with us. Sir, very cordial in nature. Sir was very interactive, so you can interact with sir. You can clarify any doubts. I request all the participants. If you have any doubts, you can clarify now. I think no questions from participants, sir. Thank you so much, sir, for participating in the program, sir. Thank you, sir.
Thank you so much.
Thank you, sir.
Navina madam, can you please hold for a minute? When sir is about to give a small announcement.
Okay, sir. Now I request all of the participants and all the delegates, please give your feedback about the 4 sessions from since morning to afternoon in the chat box. It's required nearly 10 or 15 minutes to start the validatory function. So I request within this time, you can give your feedback in the chat box. I request all of the participants. I request all the participants don't leave from the webinar. Within 10 minutes, the validity function was started. So within that time, you can give your feedback, and if you have any queries also, you can post in the topic chat box. So the session will be continued after 10 or 15 minutes with validatory function. Thank you.
Doctor.
The validity chief guest of honor, Dr. Atal Kumar Naza Garu, and the guest of honor was by Dr. Montu Kumar M. Patel, President of Pharmacy Council of India. So after that, the session was continued by the vote of thanks. So I request all the delegates to give feedback in that of link.
Please hang for a moment, guys. Feedback link will be shared to you through your respected emails. So please don't use the chat box further. Meanwhile, if you want to share your feedback, you can use the Zoom platform. John sir, a student asked in the comment section that can you please share your PowerPoint through a drive?
Okay, they
Sir.
want.
Yes, sir. They want your PowerPoint.
PowerPoint. So I have to.
Sir, just upload your PowerPoint in a drive and drop that mail link in the chat box. I'll forward that.
Okay. Give me a second. So in the chat box, I am just giving a Google Drive link. I have converted it into a PDF, so they can. It will be easy for them to even check it in the mobile.
Yes, sir. Thanks for your sharing, sir.
Can you please check whether it is working? Whether you can download it or not?
Yes, sir. I have downloaded that in a PDF format.
Navina madam. ఒక్క నిమిషం. సరే ఉన్నంత వరకు మాట్లాడతాలే. మరి ఏం చెప్తాం, ఏం చేయాలిరా? ఏం లేదు చెప్తున్నా.
Now I request our convener, Dr. Y. Narasimha Garu, Department of Pharmacology, MEM College of Pharmacy. Sir, please talk a few words about the one-day webinars about
Thank you, ma'am. Thank you, ma'am, for your concern. Good afternoon, everyone. Myself, I am Dr. Narasimha Garu, Professor, Department of Pharmacology, MEM College of Pharmacy. I thanks to management of MEM College of Pharmacy and our dynamic principal, Dr. M. Prasad Rao Garu, providing necessary facility to make this wonderful webinar. And also, I extend our sincere to all the dignitaries and respected speakers. Your presence will be enhanced webinar value. So today I will tell about World Drug Day. Power does not come from bodily compatibility. It comes from an indomitability will. As a human beings, we all have weakness that can at times bring us to our knees and turn our world up to downward. But taking the first step shows that we have the courage, will turn to our life towards good. Dear students, many of you are aware of the growing concern over the rising number of drugs abuses all over the world, which in turn leading to loss of lives and crime. Today, on 26th of June, let's we take a look at what the International Day Against Drug Abuse and Illicit Trafficking is all about. This is the day as an event is celebrated worldwide to make people, especially youth, aware about the drug addiction and illegal trafficking. Drug abuse does not only mean using drugs such as cocaine or cannabis, but also encompasses prescription medications such as painkillers, sleeping pills, and tranquilizers. The goal of this day is to strengthen global action and cooperation towards creating a society that is free from drug abuse and unlawful drug trade. And many of you are thinking that is the responsibility of government to counteract both the drug trafficking and drug abuse. It is not correct because of you all and communicate together can also make a major contribution. My dear students, when like you will grow into health, happy and productive adults, India will emerge as a superpower in the world. This is what I want to tell you. I would like to end with few words. Anyone can give up. It is the easiest thing in the world to do. But do it together when everyone would expect you to fall apart. Now that is true strength. So this is my words about the World Drug Day. Thank you. Have a nice day. Thank you so much for giving me this opportunity. I once again congratulate the organizing committee for making the wonderful program. Thank you, one and all.
Thank you so much, sir, for valuable speech about this program. And the session will continue within a few minutes. Please, all of the participants don't leave the webinar. So within a few minutes, session will be continued by the valuable function and vote of thanks.
Thank you.
నన్ను నీకు ఫోన్ చేయమని చెప్పా కూరలో
Navina madam, please continue the session.
Okay, sir. Sorry for the small delay. Good evening to one and all. A pleasant welcome to valedictory function of one-day national webinar on addressing drug challenges in health and humanitarian crisis on the occasion of the World Drug Day, organized by MAM College of Pharmacy in association with Sorry for the delay because of the small network problem. Organized by MAM College of Pharmacy, association with Indian Pharmaceutical Association State Branch. It's my immense pleasure to invite guest of honor Dr. Atal Kumar Nasa Garu, Deputy Drug Controller with charge of Controlling and Licensing Authority, New Delhi, EC member PCA. Sir completed M.Pharm from Delhi University in 1986 and worked as a lecturer in Delhi Institute of Pharmaceutical Sciences and Research from 1987 to 1992. Later, sir joined in the Drug Controller Department, Government of NCT of New Delhi in 1992. Sir was a Vice President of All Indian Drug Controller Officer Confederation. Sir successfully organized 53rd, 60th, 61st session of the Indian Pharmaceutical Congress. Sir was the President of Indian Pharmacy Graduation Association, Managing Trust of IPGA Welfare Trust. Sir worked as a Secretary of IPGA in 2001, New Delhi, and then unanimously reselected for the another 3 terms from 2003 to 2006, 2006 to 2009, 2009 to 2012. Sir awarded with the Regulatory Person of Year Award by the 54th. Sir awarded with Outstanding Young Professional Achievement Awards during 20th Annual Conference of the IPG. Sir awarded with Best Alumni Award by the DIPS. Sir awarded Best Drug Inspector Award by the AIDCOC in the year of 2001. Sir, welcome to this one-day webinar on this occasion of the World Drug Day program. Sir, please deliver your valuable information and sharing your knowledge with all of the participants. Sir, I'm audible, sir?
Hello. Am I audible?
Yes, sir, it's clear, sir.
Thank you. Thank you. Thank you very much. A
Thank you,
very
sir.
good evening to all of you.
Good evening, sir.
And on this auspicious day, I welcome all the students of the institute to this webinar. And I can simply say that drug addiction or drug abuse is a big challenge amongst the entire young community. So we have to take a pledge, say no to drugs. We have seen the preparations like hypnotics and sedatives, Schedule H1 drugs, Schedule S1 drugs, tranquilizers, and so other preparations which are widely misused for the treatment of drug addiction. So my submission, my request to all the young students attending this webinar that as a pharmacist, we have to play a very important role, that we have to prevent drug addiction or drug abuse in the entire country. And particularly the drugs which are covered under the definition of Schedule H1 or habit forming drugs or narcotic and psychotropic substance, they should be used very judiciously on the prescription of a registered medical practitioners. They should be dispensed only on the prescription of a registered medical practitioners, and a proper records ought to be maintained. With this message, I request all the students attending this webinar that let us take a pledge saying say no to drugs. Thank you very much.
Navina ma'am, okay. Navina ma'am.
Thank you so much, sir. Shall I continue the session by chief guest, sir?
Yes. Thank you. Madam.
Sir?
Continue, next continue. Madam.
Sir? I'm
Respond
audible.
Okay.
Okay, continue the session. Without delay, I would like to invite today's valedictory chief guest, great person, Dr. Montu Kumar M. Patel Garu, President, Pharmacy Council of India, President, Gujarat State Pharmacy Council, State in charge of Youth Development in Gujarat. He was serving as the President for Gujarat State Pharmacy Council of India from 2015. State in charge of the Youth Development Cell BJYM from 2021. Sir is a member of PCA New Delhi from 2019. Executive Committee member PCA Delhi from 2021. Sir was a member of Ahmedabad Chemist Association from 2021. Sir was a CEO, director and founder of the Evian Pharmaceutical Distributor from 2011. Thank you so much, sir, accepting our invitation on a busy schedule. Sir, please deliver a few words about this session, sir. Sir?
Good evening to all.
Good evening, sir.
Thank you, madam.
Thank you, sir. Sir?
Good evening.
Good evening, sir. You can continue the session.
Thank you for inviting me on the occasion of the World Drugs Day. India is the youngster country. All people and whole world are very in India, many drugs dealers and narcotic drug department are working very highly, but somehow in college campus and big university, big university, because in small university there is no possible to use drug, but in big university, many richest people's sons and daughters and politicians' sons and daughters are studying in big campus. So many times some drugs are easily available by online, by offline, easily by local people. So on the drugs day, we are the pharmacists, and in future of the India, also we are supporter of the healthcare system, because in future we are go to the community pharmacist, in a chemist shop, in an industry or any regulatory department. So codeine phosphate, man addiction of today young man addiction of today youngster is codeine phosphate syrup, codeine syrup. So many students are taking a codeine syrup routinely for taking a over the night and for relaxation, some tension. So I think we have to stop the selling of the codeine phosphate without prescription, because many chemist shops are selling coding phosphate without prescription. So I think when whatever any chemist shop are selling this type of codeine phosphate syrup, so your duty is to inform local drug department and caught him for the illegal sale of the codeine phosphate. Many doctors are also selling the codeine phosphate syrup. They are stocked there in dispensary and sold the codeine phosphate syrup. For many drugs, narcotic drugs, many narcotic drugs are sold in like many states. So today the drugs day. So my home pharmacy council India message is that we are the pharmacists and supporter of the Indian healthcare system. So we have our duty, our pharmacist duty, to stop the illegal sale of the narcotic drugs, narcotic medicines, narcotic any of narcotic preparation. So we can save our youngster in India. Otherwise, we lost our young people in the India. So thank you, and very happy to share my few words amongst you all students and teachers and professors. Thank you.
Thank you so much, sir, for sharing your ideas with us and what is the role of clinical pharmacist in the society to prevent the drug abuse. Thank you so much, sir. Now I request Jasmine ma'am to continue the session by vote of thanks.
Thank you.
I'm audible.
Good evening. Good evening, everyone. It has been such an honor to be a part of this wonderful event. On behalf of management, MM College of Pharmacy, I would like to propose the vote of thanks to each and everyone who have contributed for the overwhelming success of today's webinar. First of all, I would like to propose hearty vote of thanks to our chief guest, Dr. T.V. Narayana Garu, National President of IPA, in spite of his busy schedule, accepted our invitation and has attended here to this program for grace today's webinar. I can assure that all the participants has taken note of your suggestions, sir. I also extend my sincere thanks to our chairman, sir, Sri M.R. Sheshagiri Rao Garu, President and Correspondent of MM College of Pharmacy, for his interest, guidance, and active involvement to make this webinar a reality. A special thanks to our dynamic and great personality, our beloved principal, sir, Dr. M. Prasad Rao Garu, Professor and Principal of MM College of Pharmacy, for providing immense support to make the webinar a successful. On behalf of MM College of Pharmacy, I am glad to be a part of here to express my vote of thanks. A special thanks to our guest of honor, Dr. Atal Kumar Nasa, Deputy Drugs Controller with charge of Controlling and Licensing Authority, New Delhi, EC member of PCI, for accepting our invitation and for being here with us today. Your thoughts have truly inspired us, sir. I extend a really vote of thanks to our chief guest, Dr. Montu Kumar M. Patel, President of Pharmacy Council of India, President of Gujarat State Pharmacy Council, who spared time from his busiest schedule to grace the occasion today. We had an opportunity to hear your thoughts, and this will be surely going to encourage us in our further events. A special thanks to our convener, Dr. Y. Narasimha Rao, sir, for this continuous support to organize this webinar, and I would like to express my grateful thanks to all the esteemed resource persons of the webinar for their presence and to make this webinar a great success. My hearty thanks to all the organizing committee and my dear faculty members and my dear students for their support, dedication, and their teamwork. And my special thanks to our technical support, Mr. B. Harikrishna. And once again, I thank to one and all who supported directly and indirectly on this webinar. Thank you everyone once again for making it a great success. Without any delay, we can closing the session with the Janaganamana.
Hare Krishna, play.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Jai Hind.
Yeah, a small announcement from the participants. The e-certificates will share by your registered email, and thank you and have a great day.
సిమెంట్ పని వచ్చి కాళ్ళు ఉన్నట్టు